Hi guys, today we'll be learning about sickle cell chip in our series of biotechnologies. So, what is sickle cell disease? Sickle cell disease is where abnormally shaped blood cells have a diminished ability to carry oxygen. Unfortunately, this causes over 20,000 deaths every single year. And diagnosing the disease requires expensive equipment and trained personnel, both of which are often lacking in rural areas. So in order to solve the problems that occur with sickle cell disease, scientists have created a device called the sickle cell chip. A sickle cell chip is a biochip that is used to detect sickle cell disease. Sickle cell disease is a disease where a group of disorders cause blood cells to mishappen and break down. This biochip is a portable device that requires just a small blood sample to detect sickle cell disease. It shows promise as a point of care testing device for infants in developing countries. Additionally, when compared this to traditional sickle cell disease treatments, this is much more convenient because other treatments are very invasive and require lots of blood, whereas this only requires a single drop. This is what it looks like. The patient will need to give a little bit of blood on the card, and that will be read. So why is this technology so important? This technology is important because based on a poster presentation, more than 50% of infants with sickle cell disease die before reaching the age of 5. Sickle cell disease causes organ damage and severe pain as well as early mortality. Sickle cell newborn testing is standard in the US, but in Africa, very few infants are screened for this disease due to the high cost and level of skill needed for the test. This is a person using technology to help read the sickle cell anemia in infants. So there are some potential issues with sickle cell chip because it has some technological problems. For example, one issue about this chip is that current methods are too slow and expensive and not ideal for making diagnosis soon enough to save lives. And newborn screening for sickle cell disease in developing countries are conducted in central laboratories, which means the results can take up to weeks. Parents who test their children in healthcare centers are often difficult to reach once they leave, which delays important interventions for infants with sickle cell disease. In order to solve these solutions, here are some proposed solutions. Considering that 70% of sickle cell disease-related deaths in infants could be prevented through early interventions, there is an urgent need to develop effective point-of-care testing tests that can diagnose disease of this type while an infant is on site at a health center. So this is what a sickle cell anemia blood cell looks like. The first part is a normal blood section and the normal blood cell, which is called the RBC. As we see, the discs are very full. They're filled with rich blood and iron and plasma. However, if we see, and we also see that the RBCs flow freely within the blood cells, but if we have a sickle cell disease, they are much more clustered. They have like this sickle shape, this C shape, and they have abnormal hemoglobin strands that cause a lot of pain within the infant. And they also don't move as freely. They have a very tighter pathway, and they're not healthy. Here are the citations. Thank you.